So today we would like to have a small session on Salesforce Health Cloud. So the Salesforce Health Cloud, we know that it means the operations of patients, the patient references or patient medications or whatever the 360 view of patient can be maintained in the Salesforce Health Cloud. So the Salesforce Health Cloud is mainly focused on the hospitals, that means providers, and then even for the companies who are doing the clinical trials, we used to call them health sciences, health cloud, and life sciences. That life sciences is nothing but, so let's say if you take any company who are performing or who are manufacturing the drugs, so to track the drug situations or drug outcomes and how they are going to provide, how they are going to perform the clinical trials and how they are going to provide the dosage and their outcomes, risks, and everything. So, who the patient information, everything can be maintained in the Salesforce Health Cloud. The Salesforce Health Cloud is mainly built on sales and service cloud features of Salesforce. And apart from that, we have different communities as well. So let me go through the functionality of Sales Cloud and who are the actors and others. So this is a small session so that I'd like to give some overview of Health Cloud. So the introduction actors means who are going to work on the Health Cloud and data models. So the data models are nothing but in how many ways the Salesforce actors can be working on that, and features like what are the different the features we have in the Salesforce Health Cloud and what are the advantages. It's a small demo. Let me go through. This is the introduction. So as I said, the Health Cloud is a solution for all health cloud. I mean, hospitals or healthcare providers or the life sciences. That means the clinical trials performing organizations. This will help very much on this to care coordinators, caregivers, patients, and many other dependents like the insurance agents as well. So let me have an idea, just to overview on this. This is the patients. Patients are nothing but individual personal accounts in the Salesforce. And then here, the patient's onboarding and patient's medications and the care plans, so everything will be maintained in the Salesforce Health Cloud. The patients can book their appointments as well by providing some of the communities and others. So that is the customized functionality. And then providers are nothing but doctors or care providers or clinicians who are giving some medications or something or called as providers. And medtech is nothing but medical device provider companies like any insulin, I mean, say injections or some kind of let's say bone, I mean, some kind of steel events which will be used in the surgicals, I mean, surgery cases. So those are called medtech companies. And payers are nothing but insurance companies. We know that each and everyone will be having their own insurance policies and benefits and their insurance coverage timing and everything. So those will be maintained by the payers. And then pharma. Pharma is nothing but just like, as I said, those are clinical trial companies. So who are going to perform the manufacturing of drugs, testing the drugs, and providing the drugs to the hospitals and everything. So that will be those will be the actors of Health Cloud on this. And we have different types of data models. So the data model means that the way of operations works in the different cases, like patients, how it will be working, and then clinical, how it will be working, insurance and claims, how it will be working. Those are the things. So household is nothing but individual accounts. They may have their co-patients or they may have their household, means they will be having their own relatives and everything who is going to take care of that patient, so that everything will be taken care by the household data model. So we have different flow diagrams for that. I will explain, might be in the next session on this. So clinical is nothing but how the doctors will be operating, how they are going to check the patient information, their diagnosis information, and then their medication information, how they are going to pull into their care plans. So those are called a clinical data model. And insurance and claims, as the name said that, so the insurance, the payers, how they are going to maintain their insurance information, the membership, and what is the insurance coverage, and what are the benefits we have in the insurance plan and everything that will be there. And claims is nothing but, as we said, so they can raise for claims. And in US, mostly the Salesforce Health Cloud is mostly focused on the US Health Cloud. So that every person in US so will be having their own health plans and everything. That insurance plans will be there. So that whenever patient admit in the hospital, so they can simply say that okay, they will have their numbers, insurance number, and will raise the claim itself, so that they can come to know that okay, for this kind of diagnosis or this kind of illness, how they can treat. Like so, they will provide that payment can be done by the providers or it can be provided by the patient or something. Can so these are the features we have in Health Cloud: care coordinations, contact centers, and others. Advantage of this health cloud is to maintain the 360-degree of patient data and complete patient experience. So real-time patient coordinations and member care management. Okay, let me go through a user interface, how it looks like, and what are the features we have in Health Cloud, and how the patients can be onboarded or something, some information in the Health Cloud. Okay. So Health Cloud, we can have our demo orgs, and we can have our trilogs can be registered uh, from the Salesforce organizations. So here in Salesforce Health Cloud, we have different kind of applications. It's a demo org. I'll just go through the applications what we have: core coordination, patient engagement, referral management, utilization management, and everything. So let me explain some features which we can cover in this small session. Okay, so the patients will be always the personal accounts in the Health Cloud. We know that accounts, so we have to enable the personal accounts here. So this is one of the application, patient engagement. So this is the user interface which will be shown to the healthcare provider. That means doctors. Once they log in, they can see that their status and everything. So if they are online, then their related task will be auto assigned using the omni channel, so they can see that their task, when it is, what it is, and when they have to work on that and everything. Okay, and apart from that, here they can see that their cases. So now what the work is pending from their end, maybe what is the case we have. Case is nothing but it's kind of a appointment, and they can see that and they can work on the case here. Simply here itself they can work. So this is the status. They can keep on changing and escalated or closed. If the appointment is closed and when it is opened and what it is done, so then they can close that appointment. That is the case one kind of. Okay. And on the patient form, this is the just home page, and we have patient information related to the that specific patient which is on the account page. And here we have different kind of persons, I mean different kind of actions we have. So we have life events. So if you go to any hospital or something, they will be deciding, or they will check that what are the life events have their marriage date or COVID affection date or quarantined or isolated, whatever it is. So they can have their own life events. So based on the life events also, the doctors will try to estimate, or let's say they will try to look at the patient conditions and everything. So here they can have their medications as well. So what medications we have in the active prescription. So if they want, they can add some medications as well here. And then, so we have care request type. How many request types we have? So care request is nothing but kind of actions. Let's say if you take any diabetic patient, so the diabetic patient will be guided to have insulin injected morning and evening, and those kind of actions are called as care plan actions and something. And then details, patient insights will be having some information on that. And here in these actions at the patient level itself, the doctors or providers, they can directly verify the insurance verification or member verification on chance of PCV. These kind of flows we have. These are the Salesforce flows which are built. And let's say if they want to verify the insurance information, so they can simply this, let's say the date of birth, the user information is there, and when they click on next, so they will see that what kind of plan type they have, insurance plan type, health network or HMO choice, whatever it is. So let's say if I have health network and click on next. So here they will say that you'll ask a question, insurance plan, would you like to us to provide you in the estimate or something? So based on, let's say if you say that yes, and if you click on next, they will ask that what type of visit you are trying to go there to the hospital, sick visit or routine mental health or what it is. So let's say if it is sick visit, and then is this for current year or last year? This kind of features we have. When they click for this year or something, so this is just for insurance verification. What is the total cost and what type of, I mean, how much of amount can be paid by the provider, means insurance provider, and then one, how much you have to pay. So this is what the some kind of flows we have. So here it says that total cost of this, I mean, the estimated cost is this, member rate is this, and your plan pays $41.77. Okay, so this is one functionality what we have in the Salesforce Health Cloud. And as well, we have some other like member verifications and others as well. So here, if you see here, patient navigation, here we will be having a different, this is called patient card, which shows that in which hospital it is, the patient is there and what is the risk level and the therapy management. So conditions, whatever we have related to that patient, everything will be displayed in the patient information card. And apart from that, let's say if the patient is a regular visit, like they were for treatment for every 3 days or something, they will request for a card. So that the health card will be requested, and that can be sent through the email app or whatever it is, email or download to app. So, and apart from that, we have see medication information. Oh, yeah. So there is another actions we what we can do is we can have the news household vendors, care management referrals, and registered device. So the registered device is a very much helpful feature on this. So usually, let's say if one of the patient is struggling with some kind of high BP or something. So to monitor that information, we have a lot of devices like smartphones, I mean the smartwatches or whatever we have. So those kind of devices can be provided by the medtech companies, and then doctor will just suggest that to go with that kind of device which can be used by the patient. So then that registered, I mean that device can be registered here, so that what happens is the data which is registered in that device data will be flown into the Salesforce, so that when patient visits the hospital, they can check the data and estimate their situation as well. And based on that, they can go with the new medications or so stop the medications. That is called reconciliation. So reconciliation is nothing but increasing or decreasing the medications or dissolving the medication is something. So here we have enroll also. So you can enroll into any program for that. And apart from that, we have a care plans. So care plans is nothing but a list of tasks which can be added to the patient, so that the tasks can be performed by the patient, and then they'll be having the goals as well. So this is just overview of this patient information. So we have a lot of other features in Salesforce, like referral management. So referral management is one patient can be able to refer another patient to the hospital, and some kind of doctors also can be referred. This is like as a HR portal or something here. And then patient engagement. In the patient engagement, care coordination, directly we will be able to uh, book some appointments for the users. I mean, for the patients. So that is the brief introduction on this Salesforce Health Cloud.